Hi, welcome back to Rhoda 360. I am your host, Rhoda. As we mark International Women's Day 2026, the global community is rallying under the theme of Give to Gain. Usually, we think of giving as charity, but today, I want to talk about giving something more fundamental, giving a voice to the invincible. When we give support to the survivors of narcissistic abuse, we gain a healthier, more empowered society, especially when these survivors are women. For too long, the physical mystery illnesses women face have been dismissed. Today, we are looking at the clinical reality of how narcissistic abuse dismantles a woman's body. And we're doing this using the lenses of neurology, the cortical axis, the cortical crisis, the gut-brain axis, and the physical map of pain in the woman's body. So let's begin. The neurological blueprint now. Anxiety and chronic or complex PTSD, that's complex post-traumatic stress disorder, is something most narcissistic abuse survivors face, even when they are not with the abuser anymore. So narcissistic abuse is a bad relationship, yeah, but is still as much as a series of repeated psychological traumas. So let's dig deeper into this neurological blueprint. The first one is chronic anxiety and panic. We know that long-term emotional unpredictability forces the brain, there's this part of the brain called amygdala, into a state of permanent hypervigilance. So the woman is always seem hypervigilant. Always walking on eggshells, even when she's away from the source of the abuse, even when she is a boss in the office. Just find this person or even yourself walking on eggshells, even when you are with people you should be comfortable with. The next one is depression and invalidation, because prolonged gaslighting creates a shattered self, leading to clinical depression. So when people are always being gaslit for everything, especially coming from childhood, everything, they gaslight them for everything. They gaslight them for being good. They gaslight them for being bad. Gaslighting as a result of decisions they want to make for themselves and the people around them. Gaslighting for even following another person's decision. Gaslighting for everything just to make them look bad. When a woman, has been under this series of invalidation for a very long time, she ends up suffering long-term depression and the feeling that everything she does or think or is invalidated. The next one is a complex PTSD that I talked about earlier. And I said, unlike standard PTSD, unlike the standard PTSD that occurs as a result of, say, acute circumstances like road traffic accidents, complex PTSD results from repeated trauma over months or years. So imagine someone who has been under a form of emotional, physical, psychological, or even financial abuse for decades of their lives. A research which I'll make sure I put the link here. A research published in Frontiers in Global Women's Health 2025. Recent research highlights that psychological violence is often a stronger predictor of complex PTSD than physical violence alone. Again, a woman may suffer from dissociation. Now, a survival mechanism where the mind detaches from the body to endure pain. So, say, I'm going to give example of myself, and I've given this example in a previous video before. I don't know which I I would have, found to link it, to this page. I suffered a lot of dissociation as a trauma response because I grew up in the environment where it was like there was always physical violence. Do you understand? Physical violence, emotional violence. Now, when it's coming like that, in my own case, it could happen at any time of the day, in the night, be it nighttime, daytime, be it whether it was my fault or not, be it whether this person had issues with someone else outside, the house or not. It was always my fault. So when it's going to happen like that, the best form for me was to dissociate. Probably not physically, but emotionally and psychologically from that, from that situation. That was the only way that my body and my mind could stand, the outburst that was going to happen in that situation. I remember few years, almost about 20 years ago, the parents I grew up with, had issues with another of my siblings. And then I knew that from that instance, I was going to be the scapegoat. Because of course that sibling was going to leave. And this was me as a child, like between adolescence and teenage years, right? The other sibling was going to leave. I was going to be left alone in the house with this person. So the whole thing was going to, turn to me, the whole aggression, the whole pain, because of course these people will be enduring their own pain too. But then it was going to be poured all over on me. So yes, the best form of protection for me in this case was to dissociate emotionally, psychologically. Sometimes you want to even dissociate physically, but you do not know how to do it, especially if you've not been someone who has ever taken care of yourself. When you live with narcissistic people, they take away your will to actually do anything for yourself. It's anything they desire for you that they allow. So in many cases, I wanted to dissociate physically. After dissociating emotionally, psychologically, it did not work. I wanted to dissociate physically, but then it didn't work because I didn't have, the know-how. I didn't have people to even run to. I didn't have any other form of support. There's a reference here, and I'll link it here. The complex trauma of psychological violence. It's a study published in PubMed. It notes that psychological abuse correlates significantly with somatization. Somatization is the manifestation of psychological distress. Yes, the manifestation of psychological distress as physical bodily pain. Yeah. So let's talk about the cortisol crisis. That is the endocrine and immune collapse. There was one day before I talk about this, when I was still practicing pharmacy, I was in the community pharmacy one day, and this lady in her then almost 60 came in, and she said she's always had chronic pain, generalized chronic pain. And after, she said she had even gone to India, she had gone to see doctors everywhere, they just treat her, normally with pain medications, and this chronic pain never left her. And at this time, because I had not started healing myself, but I knew where she was coming from. And where she was coming from was a place where doctors do not go when they talk to their patients, especially patients who come in with chronic pain, be they male or female. Most doctors do not go to that, to that aspect of trauma-informed care. So she talked, and then I looked at her prescriptions, and we got in touch with her doctor, and I made some recommendations, and the doctor accepted, right? Accepted for us to give her those recommendations I made. This lady came back 2 weeks later to come and give me gift of money. This was like almost 9 years ago in a community pharmacy. I was so happy that I was able to touch that woman's life. She said she had gone everywhere. Nobody had really understood what she was suffering from. What was she suffering from? Fibromyalgia. Now, I don't know her story. I don't know the amount of pain she had gone through in life. But then I knew that at least I was able to do something to sort her out for a while. Now, when you live in fear, your body is flooded with cortisol. In short bursts, cortisol is good. It saves your life. In the long cycle, it destroys it. Cortisol firing in the body causes a lot of harm. Pain, all manner of inflammation. And inflammation can lead to, some form of chronic debilitating conditions. Another one is hormonal imbalance. Constant stress disrupt the hypothalamic pituitary adrenal axis, that is a HPA axis, leading to thyroid issues and irregular cycles. So many women are having thyroid issues, having irregular cycles. Some will confuse it with pre-menopause. Some will confuse it with all manner of things. But then it's probably cortisol firing uncontrollably at a very high rate, at rates that too much for the body or for the brain to handle. Now we have a weakened immune system, still caused by chronic cortisol. Chronic cortisol suppresses the immune response, making the body vulnerable to diseases, to infections, things that would normally not affect you, will affect you. Change of weather, any small bacteria or viral stuff will affect you. So the immune system is weak, open. The defenses are open to all manner of infections. 2025 study from the University of Glasgow confirms that domestic emotional abuse acts as like a public health issue. Domestic abuse is a public health issue, and so is the emotional one, and with long-term impact on the brain and the general health. Then we have heart palpitations. The spikes in stress-induced adrenaline causes non-cardiac chest pain. Non-cardiac chest pains, chest pains that are not related to causes from the heart. So it's not like it's the heart that is, you just have chest pain, right? Then you have the racing hearts. And it just is, most times it's misdiagnosed as just nerves. It's just being nervous. Sometimes you want to ask yourself, why am I being nervous? Why are my hands cold? Why is my heart pounding? Yes, that's the result of chronic cortisol release based on if you're still with the abuser, you're always walking on eggshells. You do not know what to expect. If you are away from the abuser and you're trying to heal and build a life outside of the abuse, your body is still battling these trauma, especially if you've not gone for any form of therapy. Then especially if you've not spoken to anybody, I advise people, even if you don't go for therapy, look for people you can trust, that you can talk to. The more you talk about these issues, the better you feel. Talking alone is like therapy. Talking alone is like therapy. What did they say? They said a problem shared is a problem half solved. Yes, we may not be able to trust many people around us. Look for people outside that at least can listen. The next one is a gut-brain axis, which is the digestive system and sleep disorders. See, many of the digestive issues that we have, especially constipation, yes, most especially constipation, is as a result of the inbuilt trauma. All the pain, the anxieties, and the dysregulated immune system, dysregulated neurological system that our body had hidden and has housed. So there are people that have digestive disorders every day of their lives. They think it's food. They think it's the water. You go to the hospital, especially in developing countries, they just tell you, it's ulcer, it's stomach ulcer. They give you medications and then you have to go, right? Nobody really follows up. The same thing with sleep disorders, insomnia. Why are our brains hyperactive at the times when we are supposed to be sleeping? At least we now know that the gut, the stomach area, the intestine, that place is the primary sensor for trauma. That's the area that really holds the trauma, that really houses the trauma, the pains, the pains from betrayals, pain from physical abuse, pain from all manner of abuses that we've endured over the years and we are still enduring. It's our gut that holds it in. And how does it show up? It shows up with digestive issues. Issues like IBS. IBS is inflammatory bowel syndrome, or even nausea. When you always feel nauseated as a woman, you're not pregnant. You always feel nauseated. You have inflammatory bowel syndrome. You have constipation. Sometimes it's even the opposite. Diarrhea. Now, there's an emerging 2026 research in this area of brain gut axis that shows that a prolonged stress reduces microbial diversity, leading to leaky gut and systemic inflammation. Just all I've been saying. The next one is sleep disorders. Between nightmares and the inability to enter rapid eye movement sleep, due to hypervigilance, the body loses its ability to repair cells. Because when you don't sleep, when you sleep, that's when the body actually repairs cells, take care of things that, have been worn out, especially during all the hustle and bustle of the day. But when you are not able to sleep to get the right quality, not amount now, because many of us lie down even for 8 hours and only sleep, only have quality sleep for about 1 hour. But when you don't do all that, when you are not able to have good quality sleep, then your body is not able to repair those cells. Another one, like I said, with that lady, is chronic fatigue. Hers was chronic pain, fibromyalgia, general body pain, and now this is chronic fatigue. I suffered chronic fatigue for a very long time. It's to you, as a person suffering it, you would think you're just being lazy. To the people around you, they would think, why is she always lying down? Why is she always exhausted? You are always suffering exhaustion. If anybody around you notices, they will notice that you're always complaining that I'm tired. I'm exhausted. Now, this cellular exhaustion cannot be fixed by rest alone, right? Because the nervous system is stuck on the mode. Chronic fatigue is because the nervous system is always stuck on the mode. It's always on. So the body cannot shut down, at least for a few hours, and actually rest. So even while you're lying down, you're scared of the outcome of a conversation that you've not even had. You're thinking, what are they saying? What are they planning about me right now? You're thinking, okay, what to do to make them happy with me right now. You're thinking, okay, I'm going to continue working on these eggshells just to protect myself. You're thinking about so many things. You're thinking you are always on the survival mode. Your body, your brain is always in the on mode. So, as a woman, you're always tired. You're always exhausted. And for this particular one, many people will not understand. You'll be called names. Your husbands will be angry because at some points you're not even able to give in. Your body, you can't because you're tired. Especially in the case when your partner, your husband, or your the person you're in a romantic relationship with is the source of the abuse or is the abuser, then chronic fatigue becomes a normal, almost normal part of your life. Let me not shatter table today. The fourth part is the physical map of pain. Physical map of pain, looking at generalized body pain, migraines, and the brazen response, holding one's breath, tensing the shoulders to avoid a narcissist outburst, leads to chronic tension headache. You're always expecting something, so you're holding your breath. Okay, what next? What next? What next? In my case, even when I was no longer, I've had like many people abuse me with various forms, life. But then there was this other main abuser. Even when I was not with this person again, I was still holding my breath, especially when it came to, because if this person couldn't reach me by phone or text messages on calls anymore, she'll go through emails. And this person will send the longest forms of intent. There are some of those emails I've not read till today. Emails probably sent like 5, 6, 7 years ago that I've not read till today. Because it was so long. It's me holding my breath. It's my shoulders always being tensed. And probably that's about your shoulders. Just to avoid this outburst. Yet you can't avoid it. You can't avoid a narcissist outburst. Because it will always come. Especially when you decide you're going to stand up for yourself. It will always, those outbursts, they will always come. And this is what leads to chronic tension headaches, things we call migraine, leads to musculoskeletal pain, body pain from nowhere. You didn't do anything, but you're just, having body pain. The last time, I think a few months ago, had waist pain. I thought about the many things I would have done to have brought that waist pain. I couldn't think of. Then a friend of mine was like, she just told me a few things I would have. And I'm like, oh yeah. Yeah, it was my brain telling my body I was not in a good place psychologically. All right, let's look at the brain fog. Have you ever experienced cloudy brain? I call it cloudy brain because it's usually cloudy. It's a cognitive impairment. My take is that's the worst thing that can ever happen, even to your enemy, having a cloudy brain. Some people will tell you, my brain is full. I don't know what I'm thinking about. My brain is just full. So it makes people unproductive. I call it an impairment. If you allow me, I can debate that this is a disorder that public health people should take seriously. brain fog is often, the result of neuroinflammation caused by chronic stress, making it difficult to process information or remember details. That's memory problems already. I don't want this video to be too long. As we mark International Women's Day 2026, a call to action will be against medical gaslighting. Now, as part of, I know that, a call to action will be for families, for friends, to know how to, take care of the women in their lives, for women to know how to support women, give to gain, and things like that. But my own call to action today is against medical gaslighting. What is medical gaslighting? When you tell the woman it's all in her head. This woman has come complaining severally that this is a circle she's experiencing. And then you look at her and say, madam, maybe it's just you that is thinking about that. You are a professional in a setting, even if it's not a clinical setting, and someone is voicing out their trauma or something they've been battling with. I've mentioned so many things, maybe 1, 2, or 3. There are people that have even battled the 10. I don't know how many things I've mentioned right now. Stop medical gas. Stop telling people it's in their head. Stop telling people, just go and sleep. How would they sleep? Some people cannot even sleep. Stop telling people, maybe you just need to take a walk. Clinicians try and dig deeper into why a woman will make that kind of complaint. Sometimes speaking about their trauma alone sorts out their pain. So as part of this year's Right Justice Action, which is also a focus for International Women's Day, we must address medical gaslighting. And because there are statistics that show that women seeking help for these 15 symptoms that I've mentioned are often told that it's all in their head. I've said, we also have a 2026 review in the Journal of Women's Health that found that women wait significantly longer for pain treatment than men because their physical symptoms are often dismissed as psychosomatic, as they all being in their head. In Nigeria, they'll say, women have problems too much, and then they just leave them like that. So friends, to give to gain means we must give survivors the benefit of doubt. We must give them medical justice. If you experience any of these symptoms, you are not failing and you are not alone. Your body is testifying to the stress it has endured. As a survivor myself, and as a survivor watching me right now, your healing is an act of resistance. You deserve to be heard by your doctors, by your friends, by your community, by anybody you find yourself with. See you in the next episode and keep living in your 360 truth. Cheers.